Hello everyone, I am In Rae Cho from Seoul National University. First of all, on behalf of my colleagues, I would like to express our gratitude to GIE for providing us with this opportunity to present our research. Today, I am going to talk about our research titled as Diagnostic Performance of EUS elastography for Differential Diagnosis of Gallbladder Polyp. Gallbladder polyps are often discovered during abdominal ultrasound examination as part of routine health checkups, and they are known to be present in approximately 5 to 10% of general population. While most gallbladder polyps are non-neoplastic, small proportion are neoplastic and carry a certain malignant potential. Therefore, accurate differential diagnosis of a neoplastic polyp is clinically important. However, discriminating between neoplastic and non-neoplastic polyp is challenging. Histological diagnosis of gallbladder polyp is not possible before the cholecystectomy. Therefore, the differential diagnosis relies on ultrasound features such as size, morphology, or echogenicity. The size of the gallbladder polyp is the main factor used to make clinical decisions. Generally, cholecystectomy is recommended for polyps larger than 10 mm. However, the 10 mm cutoff is supported by low to moderate quality of evidence, mostly derived from retrospective studies. Therefore, we thought that adjunctive method for differential diagnosis of gallbladder polyp is necessary. Endoscopic ultrasound has been widely used for the diagnosis of various pancreatobiliary disease, and EUS elastography is an emerging non-invasive technique for evaluating tissue elasticity. This slide shows the principle of EUS strain elastography. When pressure is applied to a specific tissue, degree of deformation is different according to the tissue stiffness. So, a strain, the degree of deformation is different according to the tissue stiffness. EUS elastography has been used in the differential diagnosis of gastric SET and solid pancreatic lesions. However, the usefulness of EUS elastography in differential diagnosis of gallbladder polyp has not been investigated. Thus, in this study, we aimed to investigate the diagnostic performance of EUS elastography for the differential diagnosis of gallbladder polyps. Patients with gallbladder polyps were prospectively enrolled from June 2020. All patients underwent EUS elastography with the strain ratio evaluation. SR value is calculated as strain of reference normal mucosa per strain of largest possible area of the polyp. Final diagnosis was made via cholecystectomy. Until November 2022, a total of 88 patients were enrolled. Among them, 53 eligible patients were divided into two groups, neoplastic and non-neoplastic group, based on their final diagnosis after operation. Neoplastic polyp group patients were further divided into benign and malignant polyp group. Patient demographics, EUS characteristics, and SR value were investigated and compared. When comparing strain ratio values between groups, SR value for neoplastic polyp is significantly higher than non-neoplastic polyp. There are also significant differences in SR values between non-neoplastic, benign neoplastic, and malignant polyps. In multivariate regression analysis, strain ratio value was an independent predictor of neoplastic polyp. To investigate the clinical utility of EUS elastography in situations where decision-making is difficult, we performed subgroup analysis with 34 patients who had relatively small gallbladder polyps, 15 mm or smaller. In this subset of patients, The median SR value for neoplastic polyp is also significantly higher than non-neoplastic polyp patients. In this subset of patients, cholecystectomy was performed and 9 patients showed neoplastic polyp and 4 patients showed cancer with high SR value. Of course, this study has several limitations. This study conducted in a single institution with a relatively small number of patients. There may be bias on the process of patient selection for EUS and cholecystectomy. And there is possibility of inter-observer variability when interpreting elastography result. Despite this limitation, this study has own value as the first well-organized prospective study to assess the clinical utility of EUS elastography in the differential diagnosis of gallbladder polyps. EUS elastography may be helpful in the decision-making for treatment and follow-up of patients with gallbladder polyps. Thank you for your attention.